There is a special power in telling a story. There is a beauty, an art, a unique ability when one utilizes the tools and insight they have to transcend a message. We, the students from Bridging the Gaps, come from eclectic educational programs. However, this summer, we all underwent specific experiences that grounded us in our work and molded and shaped us in a special way. From these experiences lie our story. From these experiences lie our message. Our hope is that in some way, from our art, we pass along the seeds that were planted in us, and we implore a space for a better today and tomorrow.
This is a story told by a woman who has started a project on the streets of Kensington, Philadelphia. In cooperation with the people who live in that neighborhood, many of whom are addicted to opioids or other substances. The sound is a bit rough because we recorded these interviews in the field. For the remainder of this story, you will mostly hear her voice.
I met my husband here. I used to come here and sit outside of a construction site every day with my hard hat. I got a hard hat from a store and my work boots because I knew I wanted to work. I knew I had to make it, and I knew I couldn't be a product of my environment anymore. And I knew I had to make a difference. So I knew I had to do something. I knew selling drugs was ever an option for me. I knew going back to prison was never an option for me. And I knew I had a parole officer. So I knew the odds were against me. So I knew I had to do something. So I knew I had people watching me, but I knew my other part of myself was watching me too. I was afraid of myself, and I was afraid to fail. And failing was an option for me. So I used to go sit outside of a construction site every day. And like I was going to work, but I wasn't going to work. But I knew in my head I was going to get hired at that job. And I sat there every day for about 2 months straight. And I knew everybody's names, but they were going to work. And I knew the foreman, I knew the superintendent, and I knew everybody. And I had a cooler, I had my lunch and everything. And I used to speak to them, and they'd be like, hey, I opened the gates for them, but they were going to work. And one day, in the 3rd month, somebody didn't come to work. And they was like, hey, and I was like, what? And they was like, you want to come to work? And I told them, stop fucking playing with me. And they was like, no, bring your ass in here. But I didn't work there. I was just sitting outside.
We're not horrible people. We are just in horrible situations.
The main thing that she wanted to tackle was her mental health, as she felt that she has never attempted to tackle that topic before in her life. She states that mental health in the Black community is still making strides to be more visible, so she never felt she had anyone to go to talk about her marriage or her other issues in life. Her story reminds me a lot of the stories of the people living in Kensington. That is why places like visitation homes are so important, because it gives people the chance to get their life back on track when they are not worried about surviving the day. They can focus on building positive habits at the visitation homes as the basic needs of living are taken care of. Permanent housing facilities are so important to give people the ability to hit a mini pause button. Some folk are stuck in the cycle of poverty and never given the chance to get on their feet. Her story and the story of those who live at visitation homes illustrate what can happen when people are given the opportunity to restart. Moreover, her story also sheds light on how mental health plays a factor into the lives of those who have fallen on difficult times, and the power it can have if those needs are addressed.
For my storytelling project, I interviewed a lawyer who works in the special needs department of St. Christopher's Hospital for Children. Throughout our interview, the lawyer kept coming back to the theme of extreme dichotomy in Philadelphia. Some areas have a complete lack of resources, while others have an overabundance. My mixed media piece illustrates the concept of this dichotomy, with Fair Hill, dark and worn, being overshadowed by Society Hill, colorful and thriving on the right.
I had the honor of interviewing this amazing individual, and I thought the best way to capture who he was and the community at large was through the two beings he loved most, his girls. To see this man, who had spent the past 30 minutes reflecting on growing up in a neighborhood he now no longer recognizes and telling stories of unfathomable challenges in the military, break out into the biggest smile full of joy and love for these two turtles was an incredibly profound and pure moment to behold.
For my storytelling project, I wanted to portray his experience with cancer, complicated by his lack of resources due to chronic homelessness. I painted a mock apartment room, similar to his room, a messy room, as he was unable to take care of it at the end of his life. Yet the messiness also signified the difficulty he faced at the end of his life in accessing care and assistance that he needed as his health declined. The bars on the windows with the ironic "Home Sweet Home" on the wall were meant to be the focus of the painting. Housing was a gift that he cherished and appreciated. Yet due to chronic homelessness, the resources they were able to provide were the extent of his resources. The barred windows signified him being both physically trapped in the only housing that he could obtain, but also trapped within his own failing body. His trapped situation is one that I would often reflect on, as I would be able to go home, exercise, cook, and enjoy my own free time. Yet he would be in the one room that he can call his own, stuck within his own mortal body as it came to its end. The Home Sweet Home not only creates the contrast to the barred windows and messiness, but also is meant to capture the idea that although we as a society strive to provide housing to those who are without, it is often not enough to be called a home, as I have learned this summer. While does amazing work to provide food, housing, and assistance, there needs to be support on a societal level to integrate those who have been and are currently homeless back into society and the healthcare system when necessary. Regardless of housing, there are still barriers that must be overcome in our society in order for those who have been homeless to truly feel at home.
When asked how healthcare providers can take better care of their patients, the person I interviewed suggested looking beyond the walls of the hospital into the community.
Do right by someone. This creative piece is the reflection of a conversation with a community member at the Camden Coalition. It highlights the theme of looking deeper than the biases and negative perceptions patients face from a healthcare system that doesn't protect its vulnerable persons. As each layer is opened, we learn more and more about the true needs of the patient. The exterior of each layer shares personal stories demonstrating this core philosophy. Drugs, violence, and gentrification are among the issues he lists as issues that stifle his community. He discussed with me how the media depicts Camden as being this dreadful community, but fails to provide solutions for the cause of its supposed dreadfulness.
Title: City Invincible. In a dream, I saw a city invincible. Taken from Walt Whitman's poem, I Dreamed in a Dream. The excerpt is the current motto of Camden. To me, that quote embodies the spirit of Camden, a resilient city that once was safe and grand, that suffered after the introduction of illicit substances in the late 20th century, and is now trying to transform into a safer community.
I'm alive because of the way the city handled the AIDS pandemic. To the future doctors, honesty is everything. Sugarcoating things never helps. Lay out the facts in an orderly medical fashion and help in the patient's decision-making. This poem describes the experience of an immigrant family new to the North Philadelphia community who has had a difficult time with the transition and is nervous to seek help. It shares the apprehension a family can have when any given day someone could come knocking on your door. Traffic rumbles on with horns, sirens, and stress. A single crack in the ceiling means that water falls slowly, drip after drip. Upstairs in the attic, your children are sound asleep, waiting for the day to come. You see a shadow approach, nervous as you may be. Finally, there's a knock. Appointments have been missed, months have gone by, knock after knock. You open the door to an unfamiliar face waiting for the day to come. Is this DHS for my children? Is this immigration enforcement? Is this a detective for the crimes that happened on my block last week? I shouldn't have opened up. I shouldn't have woken the kids. I don't want any trouble. What's your name? Why are you here? Waiting for the day to come. Conversations are had and together goals are set with reluctance and concern. Your numbers are exchanged and a decision is made to accept this support. Appointments are rescheduled with these goals in mind, waiting for the day to come, with translation, transportation, and appreciation. The water still drips, the horns still blare, but now there is a plan. You slowly begin to forget about waiting for the day to come.
This piece was inspired by my interview with Fuentes de Salud staff member I. She described to me what it was like to work for the South Philadelphia Latino community, most of whom are immigrants. On the foreground, I have a picture of a masked family walking toward the viewer. This is supposed to represent the uncertainty that the last year showed and the resilience that arose from it. When all is lost, there is always the option to move forward.
Someone new is at lunch today. Wavy black hair, caramel skin, eating chana masala. Maybe she is like me. I think about telling her who I am. We share a culture, but I am black. She is not. Deep breaths. I'm actually part Indian. My body stills. Will she reject me? Used to mockery and in disbelief, I am no stranger to unbelonging. She grins. We talk about my grandfather, his food, his home, my culture. We talk about our heritage, richness of weddings, holy food. Can we visit the homeland? Maybe she is like me. I think about my blackness. We share a culture, but she looks desi. I do not. She breathes in. I am actually part Arab. My body stills. Will she understand me? Caught between worlds, we are no strangers to unbelonging. The Indian in me smiles and comes out of hiding, slowly. One day during lunch at my site, Covenant House, I talked to a youth who noticed that I was eating Pakistani food. She revealed to me that she was part Indian, but would often not tell people about that part of herself, since many would not believe her since she was black too. We bonded over our shared culture and connected on the struggles we both have faced with our identities. At the end of the conversation, we both admitted to feeling more comfortable with the diverse parts of ourselves.
Healthy Newsworks is an organization striving to engage students in health and literacy. As the HNW mission states, the staff members, volunteers, and board members strive to help develop children's power of inquiry and to develop them to share health information with their community. Drawn here is the growth of a seed into a plant. We can see in each panel that the seed gets larger, grows more leaves, and settles more roots. In speaking with a board member who has worked with Healthy Newsworks for more than 10 years, I discovered a common theme about growth and development surrounding H&W's efforts over the years.
An illustration on advanced directives.
People should not judge North Philadelphians by their cover and should know that there are many untapped seeds. And sometimes these seeds don't get the sunlight or the water that they need, whether or not they don't have access to it. But if you just tap into it a little bit and let a little water flow through the cracks and crevices, a little bit between the concrete, you will find there is so much talent, so much skill, so much intelligence, so much joy and happiness. They're such normal kids that are put in abnormal circumstances. They've just had some unfair hands dealt to them. My time at NCS has allowed me to wholeheartedly agree. NCS gives the kids an opportunity to be just that, kids. The dark background of this piece represents some of the abnormal circumstances or trauma the kids have had to live through. In contrast, the young boy in the lower corner is blowing bubbles, a staple activity of childhood. The bubbles are snippets of the NCS grounds, where the kids are allowed and highly encouraged to be kids. People here care about the children and how they are doing. Kids who have tough situations at home or with their families aren't treated any differently at Northlight. No matter what background, where they come from, what they look like, the children are all treated the same. And as we get to know the children and their families, we can provide support as needed. If grief and trauma at this level remains unhealed, it can rip families apart. She was determined to hold her family together and ultimately extremely successful at turning the situation around for herself and giving back to her community in an extremely impactful way. She is now working on starting a sibling support group for the younger family members that may be impacted by these types of traumas.
The art piece that I submitted is called Look Out for You, Look Out for Me, which is a direct quote from him, signifying the support and camaraderie of the veteran community. Whether you see the art piece upside down or right side up, the veteran is holding up the other veteran, just like how the veteran I interviewed is now holding up other veterans.
I am a Black veteran. I want people to know there is no integration in war. Freedom means separate according to the Declaration of Independence. My favorite memory of my service is unquestionably the camaraderie. It is built upon the same foundation as the Philadelphia village I grew up in, like the Boy Scouts I was a part of. But military service was also filled with cognitive dissonance among people like myself, suffering from post-traumatic slave syndrome, described by Dr. Joy DeGruy. The VA has resources, but apathy and myopic leadership kept them from helping vets. I've learned to pick my battles. There is nowhere to vent, but to be silent is to be complicit. Why do we have to jump through hoops when we're clearly veterans?
The John C. Anderson Apartments are an urban LGBTQIA+ friendly senior apartment community located in the heart of Center City, Philadelphia. The two women drawn here are one of the couples who live at JCAA. They said they only wish that people recognize them as human beings, just as you might anyone else. To treat members of their community with patience, kindness, and compassion is all they ask for.
I wanted to be with somebody that understood him. And I blame myself, but it wasn't me. He wanted to be down there with people that was like him. They shared something. We didn't share anything. I wasn't an addict, so me going down there when he died, I went down to Harrison and I sat in that park and I wanted to know what was it about this park and these people that he always wanted to leave. He had a beautiful home, we had a beautiful family. He didn't have to be down there. But it was just the people that was like him, that shared the same struggle mentally and just the same stories, I guess. When he died, I knew that. So I have to help the people that he loved to be around. I started my outreach program called Stop This. They might fuck up sometimes, and this can happen to anybody. I don't know how my husband became an addict. I don't know what he was ever thinking in his mind, but I just hope that it don't happen to my son or my daughter, but if it do, I fought for your son. I fought for your daughter, and I fought for your mother. Cause sitting and waiting for something to happen is not an option for me. And I'd rather be out there every day so no one can get mistreated. I don't want to leave no one behind.
These were only snippets of individual projects, just as our experiences this summer were only snippets into the lives of those we encountered. Our work must continue beyond these 7 weeks in order to immerse ourselves not only into the fullness of the stories and lives around us, but in order to inspire and make the changes we know to have such deep need. For the roads we walk together, we must strive to make them better, if we can, when we can, and how we can. For they are our roads after all.